That was an amazing speech, and you know, these are really strange times. I'm Peter May, I'm chairman of the boards of Mount Sinai, and I'm going to talk a little more of a traditional graduation speech, but what Ken had to say is really critical. In today's world, we are, you know, as an institution, Mount Sinai is probably as strong as almost any academic health center, certainly in the Northeast and probably in the country. And we know we're going to survive all the problems that are in front of us, but things are being made more and more difficult to be able to carry out the mission that we're so proud of. So it's an honor to share with you this really wonderful and momentous day, the culmination of an education at the Icahn School of Medicine at Mount Sinai, which is one of the foremost academic medical schools in the country. Throughout your training, you've benefited from being part of one of the largest integrated healthcare systems in the nation during a time of extraordinary change. During your time at Mount Sinai, you've seen how our world-class clinician scientists are rapidly transforming our understanding of disease and bringing the results of their innovative research back to the communities we serve. These breakthroughs are already impacting patients in real time by opening up new avenues for treatment and offering renewed hope for patients living with a variety of conditions, from cancer to neurodevelopmental and neurodegenerative diseases. And yet, part of the Mount Sinai community system is a community, and there you've also seen that innovation is not confined to our laboratories. Rather, it's a core value of all the work that we do and the care we provide in our 7 hospitals and more than 300 physician practices, clinics, ambulatory care facilities, and community-based programs that comprise our system. Indeed, since Mount Sinai was founded in 1852, innovation has always been closely tied to patient care and our ability to better meet the needs of the diverse communities we serve. Today, our community is larger than ever. Our network touches virtually everyone in the New York metropolitan area and serves more than 3.5 million patients. Faced with the rising costs of healthcare and the growing epidemics of obesity, diabetes, and opioid addiction that are devastating some of our communities, many of the people we care for rely on us more than ever to develop programs that promote health and prevent illness and deliver the best, most timely care possible. To meet these needs, Mount Sinai has made significant strategic investments to become a leader in the transition to population health management, refocusing our efforts on keeping people in our communities we serve healthy over the long term, rather than only treating them when they're sick. Already, we've begun building successful programs that are driving the transformative changes in the patient experience and by delivering higher quality, continuous, and more coordinated care at lower costs. For example, our independent practice organization, Mount Sinai Health Partners, which is a network of our faculty physicians and our associated community physicians, enables us to collaborate with health plans to reward physicians for delivering better, more efficient care at the right time, in the right setting, and improving patient satisfaction. Likewise, our accountable care organization, Mount Sinai Care LLC, is integrating our programs and developing new methods for streamlining care across a range of services, from chronic disease management to specialty care and complex procedures to prevention and wellness. Our preventable admissions care team takes a patient-centered approach to address the medical and psychological needs of patients to prevent hospitalizations. And our mobile acute care team, which we call MACT, a new hospital-at-home pilot program, provides a suite of services to patients who would otherwise be required to be admitted. The MAC program now admits 30 to 40 new patients per month and treats them at home, making it one of the nation's largest home hospitalization pilot programs. And our initial results show a 55% decrease in readmission rates. These and other programs not only transform the way patients experience and receive care, they're also the cornerstone of our ongoing efforts to transition from a fee-for-service model to health management. This reduces unnecessary costs while rewarding the quality of care we deliver and the health outcome of our patients. Indeed, it's essential to the sustainability of our healthcare system, and that we align financial incentives with these values. As these changes continue to take effect, we will see our patients and our communities become healthier and better cared for, while we finally begin to contain healthcare costs. And just to add to something that Dr. Davis said, this is the way we're going to have medicine work in the future, by changing the model of how we deliver medicine rather than just cutting the people who are covered. So class of 2017, as you embark on the next stage of your careers, this ongoing shift to population health management will profoundly change the way you care for your patients. I encourage you to embrace these changes. The training you've received at Mount Sinai has given you the tools that you need to make the challenges. And knowing what you've already accomplished, I have every faith that you will be compassionate and formidable leaders of this exciting evolution in healthcare. On behalf of all of the trustees and all of the faculty at Mount Sinai, I congratulate you and wish you all the best for long and productive careers.